Hi, this is Dr. Mark Agresti. I'm doing a video on drugs that cause or may increase the risk of you getting Alzheimer's or cause memory problems. Alzheimer's scares me more than any illness in my office, and I'll tell you why. There's no treatment, there's no cure, there's a bunch of drugs which they say help, but I don't even see them help. I think the rate of decline is consistent throughout. And I go into detail in my book, Tales from the Couch, about the caretakers of Alzheimer's, the impact this is having on our society. To me, it is the worst illness that I see in my office. It's chronic, it's a 20-year course, and eventually you wind up dying from it, but it's a death by 1,000 lashes because it slowly takes away who you are. There are 5.8 million Americans with Alzheimer's. There's no real treatments and no real cure. There are things which may possibly delay some of the symptoms temporarily. So what drugs out there cause or increase the risk of Alzheimer's? Just some general chemistry, there's a neurotransmitter called acetylcholine. And this is involved in muscle contractions, pain responses, sleep, and the thought processes of our brain. So if you block it, you don't think clearly. Now, there are very common drugs out there that people are taking every day. They're called anticholinergic drugs, and when I say the drugs, the chemical name is diphenhydramine, brompheniramine, and chlorpheniramine. Now, that may sound a little strange, but those drugs are in common medications. You know, everyone's popping Tylenol PM, Motrin PM, Advil PM, Robitussin, Sominex, Unisom. All those drugs have anticholinergics in them. They're extremely dangerous and increase the risk, maybe 54%, 80% increased risk of getting Alzheimer's. So it's nothing to laugh at. It's serious. And I know people who take these chronically for sleep or because they have a muscle ache or blah, 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 blah. They're dangerous drugs. I have family members who I will not name who, in spite of my insistence on not taking Benadryl PM, and I have issues with Tylenol PM, by the way. Not only does it predispose you to increased risk of dementia, you're also taking Tylenol, which damages your liver, and people drink on it. The liver damage increases dramatically when you drink on Tylenol, but don't even get me started with that. That's another lecture, which I hate that drug. Also, drugs for gastroesophageal reflux. Tagonit, Nexium, Prevacid, Prilosec, Zantac, all those drugs are anticholinergic, increase your risk of dementia, and whatever. Claritin is another one. Allergies. People who suffer from allergies take drugs which may increase their risk of dementias. There's another one. Tricyclic antidepressants. Elavil, nortriptyline, dizipramine, imipramine. All these drugs may increase your risk of dementia. There are drugs for overactive bladder, uricoline. That increases your risk. It's another type of, it's called an antimuscarinic, another type of anticholinergic. In general, these drugs, anticholinergics, are used for sleep, gastroesophageal reflux, urinary incontinence, Parkinson's, chronic obstructive pulmonary disease. There's another class of drugs which may increase your risk of dementia. Lipitor, Crestor, Zocor. 80% of the people who take statins have memory problems. So these may cause permanent brain damage and permanent issues with increasing your risk of dementia. The third class, benzodiazepines. Commonly used ones, Xanax, alprazolam, lorazepam, which is Ativan, Klonopin, clonazepam. Those are the big ones. There's other less used ones, Prosom, Librium. There must be about 20 of them. They're used for sleep, anti-anxiety, and seizure. And the fourth class could be opiates, painkillers, Oxycontin, hydrocodone, oxycodone, codeine, those drugs. That's it. Maybe I'll bring up a few medicinal or homeopathic remedies. There's something for sleep, which could be L-theanine, glycine, GABA, lavender. You can buy it in a capsule. Magnesium. These can help you sleep naturally. Things that could be used for your stomach, gastroesophageal reflux, it's buffer pH. You could buy that on Amazon.com. It changes the pH, the acid-base balance, making it more alkaline, so you don't get gastroesophageal reflux. And then avoid spicy, fried foods, alcohol, aspirin, Motrin, and changing dietary habits, avoiding acidic foods like tomato. And then things that may help. Maitake mushrooms are known to help with memory. And I've read an article on honey. Thank you, Dr. Mark Agresti. And I get into this in a long chapter in my book, Tales from the Couch, where I get into what it's like to be the caretaker of someone with dementia. Thank you.